you so much for the invitation for the second time to this conference. The earlier one in Bangalore, which I had the opportunity to present at, was also extremely interesting, and what I like about the audience reach out is that it is very diverse and very different from what one normally sees in healthcare environment, which I think, given the topic, changing landscape, is exceedingly important. Because if we don't realize that the stakeholder has changed, and there's an immense diversity in the stakeholder, the story which was very beautifully painted on a canvas by Dr. Sharma, we will not be able to grasp, or we won't be able to know which are the strokes of brush which are needed and where it is needed. So with that background, I just have a couple of slides which are essentially holding slides, as I would say, and I'd like this to be an interactive kind of talk, because otherwise to me it is meaningless if I don't know what you are thinking about what I am saying. So net, I'm not a sage on the stage. I'm not. And that to me is the crux of the changing times in healthcare. So I borrowed this slide from the last conference in which Dr. Jairam from Columbia, Asia, had shown this wheel. Now, if some of you have attended that conference, and I'm sure it is on, Shishir assures me it's on the web, if you were to see that piece and look at this piece, you can see how it has changed. When that was presented last year, it had the patient at the center. Today in India, the center is Ayushman Bharat, right? And all the wheels are going to be revolving around this center. So what all is going to be impacted by Ayushman Bharat? Clearly, technology, change in the population needs. So now you have 50 crore people, give or take. It means the entire population of the United States, Canada, and plus. Or the other way of looking at it is, Europe, discounted by 5%, is the kind of population that is going to be covered in 50 crores. That's no mean feat. And if you were to look at the kind of runway that you have into operationalizing such a huge social scheme, people have taken decades. We are taking it in months. So the change is going to be intense. Is it going to be a disruptor? Absolutely. It's going to be a disruptor in each and every part of what you're seeing in this slide. So if you see here, sorry, could I have the pointer, please? Yeah, she said. If I were to see, just if you were to focus on the three topmost parts of the wheel: limited system resources, advances in technology, changing population health needs, heightened consumer expectations, a changing workforce, new models, new service providers, health system reforms. This is what is going to be what you see. You are going to see this. So what are you seeing? As Dr. Sharma said, new advances in technology, which then will be questioned by the consumer. Do I need this new advance in technology, or do I not need this advance in technology? What is the impact to the dailies in an individual? Or on the other hand, what impact is it for the person who's paying for care, whether it is me personally or whether it is an insurance company? Limited system resources. There is no country in the world which has a bottomless pit of finances to take care of one's health, which then begs the question, what is appropriateness of care? Is appropriateness of care such that 90% that what I spend on healthcare will be spent in the last 1 week of my life? Is appropriateness of care hand-holding me through the journey of life in preventive health? Therefore, technology which has to be adopted should actually be directed towards that 90%, or should technology be such that is going to be directed towards my last 1 week of life? These are the kind of questions which are going to be asked for by the very person or persons who are at the center of care. Health system reforms. What I said just now will directly impact the system of reform. So today you have a system which says, I need evidence to be able to tell you that you are in good health. Therefore, I need this battery of tests, I need that doctor to certify, and underpinning this is technology and equipment to enable me to give you that evidence. I need that record behind me to be able to substantiate what I'm saying. So the system will then need to reform itself and have guidelines which ensure both the consumer of health and the provider of health should follow the same guideline. New service providers. So the new service provider is going to be who? The new service provider, is it going to be the individual who's looking after you at the last 1 week of your life? Or is the new service provider going to be who's going to look after you 90% of your life? Which then will throw up new models of care. When these new models of care will come up, they will come up as either point of care. I can look after myself at home. And that at home may be in rural India, may be in urban India, or it could be tier 1, tier 2, tier 3, tier 4. That will bring up new models of care. A changing workforce. Why a changing workforce? Because if you look at, I want care at my home, at my doorstep, the individual who is going to look after me at point of care now needs to be a 360-degree provider. So that individual should be comfortable with technology, comfortable with writing a prescription, comfortable with being able to interpret an ECG, comfortable with giving me injection, and most importantly, the law must empower and de-risk that individual. So the changing face of workforce, what is it going to be? Is it going to move from the traditional fashion? Is it going to be a doctor which is underpinned by technology? Is it going to be a nurse? Is it going to be a multi-purpose worker? This is going to be another very, very interesting part which is going to come up. Heightened consumer expectation. If till today I hesitated, so I drove into the hotel. Now just picture this. I have never stepped out of my 1.5 kilometer radius from my village. I've never. I have not even got onto a bus. At best, I might have got onto a bullock cart. And now I'm given a piece of paper which says I can go anywhere in this country, including places like this, and say, you know, this is my card, and I'm sick, and you have to take care of me. I've suddenly got a voice. There's going to be trepidation as far as that individual is concerned, but be rest assured that that is only time-bound. Once the power of that card and what it can benefit the beneficiary, what it brings to the beneficiary, life is going to be very, very different. What will all this need? Infrastructure? Absolutely. Either the existing infrastructure will have to adapt to the new needs, or new infrastructure will have to come about. Will it mean that we have centrally governed critical care units? Will we have doctor on calls? Will we have another form of telemedicine? It's going to evolve with time. Interdisciplinary work. You cannot provide care any longer thinking you are the sole master of what you are. Interdisciplinary, and here I want to make this very clear. Interdisciplinary means not only clinical folk, it also means non-clinical folk. Clinical folk is the entire value chain of technicians, nurses, paramedics, doctors. Non-clinical folk are all the managerial support. Dr. Sharma made a very interesting comment, and he said that we will never try and cap the cost of workforce. I'd just like to share some statistics which have come out from where traditionally, because we feel that their data is kosher, from the United States, from Berkshire, they said that the workforce cost in the United States is 27%, right, of all costs. And out of this 27%, 12% is clinical costs. And 15% is management cost, not managerial, but management cost, right? So there's a huge debate as, is this management? Is this managerial? Now it depends upon what you look at. So you have a doctor who's given a time slot of 10 minutes to fill in the electronic health record. So either the individual will fill it in, or there will be managerial staff who will then fill in this electronic health record. God forbid the punching in of the data is inappropriate or incorrectly done and it ends up into a medico-legal case, then who is responsible? Who is liable? Right? So these are the kind of challenges and questions that are coming up. Yesterday we launched, under the Healthcare Skills Council, we shook hands with the Ministry of Health and Family Welfare, much as we supported Dr. Sharma in his Skill Council. And knowing the challenges of delivery as well as taking care of the beneficiary, we created and crafted a role called the Ayushman Mitra. Because unless that Ayushman Mitra explains to the beneficiary and is the in between the service provider, the payer, and the beneficiary, there would have been mayhem. Most importantly, given what I said earlier, the trepidation with which the patient is going to come, somebody has to explain to that individual what that card means. And in a country which is beleaguered with corruption as well as fraud, how do you ensure that fraudulent measures are not adopted across the delivery chain? So, is this individual a dispensable individual, or is this individual absolutely necessary, is what is going to now change, and this is the question the new delivery system is going to throw up. Cost-conscious care delivery. Much has been said, and all of you have read this time and time again, that the cost at which the service is going to be provided for, the prices are absolutely untenable. Which then circles back to my point, which says, what is the appropriate care that I need? What is it? Have you been able to define it? No. If you were to put a hand to your heart, across the world, we have not been able to define the appropriateness of care. Each country today is beleaguered with this problem statement. If you look at the new WHO guidelines on them, everybody is scrambling around and looking at it. What is going to be the solution to this? So the solution to this is, in the delivery model to roll out Ayushman Bharat, which is going to be the biggest disruptor, there's absolutely no doubt that PPP is going to be the only way forward. Given the paucity of time, today we are sitting on the 28th of August. This rolls out on 25th of September. Can you imagine the challenge which is occurring today? That 50 crore people have to be not only sensitized, but they are going to be given a letter with a QRC code on it, by which they will then go to the primary health centers, hospitals, and say, this is my letter, this is my code, now issue me the e-health card. It's a huge challenge. Just imagine the number of people who hitherto could not get into a hospital for fear of coming in. They are all going to be there. They'll come in trickle, but then there may be a tsunami, right? So the question is, how do you manage this particular piece? And what will this disruptor mean for both the public sector as well as the private sector? Ecosystem challenge. Look in the recent 6 to 8 months. How is government trying to manage? It's trying to regulate, rightfully so, bring down prices. As Dr. Sharma, who is trying his level best to bring down the cost of devices. On the other hand, the average realization of hospitals is plummeting. It's plummeting. So at the end of the day, each individual, whether it is AIIMS-like institutes where they put in money, just so that you understand, when you start a hospital, you make a projection that I need X amount of money. Some of the AIIMS-like institutes and public institutions, which were supposed to be completed in 2-3 years, have gone way beyond, and it's 10 years and they're still not operational. So if they budgeted, if government budgeted, I needed 100, today they need 400. They also don't have the money. That again is a huge challenge. If you look at the models of care which will survive, this is a recent report which shows that despite the numbers going up, the revenues don't match it, and thereby it's essentially a train which is hurtling along and has now is showing signs of rattling. Why? Because the rails have changed. The rails have changed, and these rails will continue changing. What is changing this? This is changing it. If I were to earn an X amount so that I could reinvest it into my company, I don't have that earning anymore. Government, again, when they started the program, since one has been very closely associated with the rollout, original thoughts was the central government would pick up most of the tab. As they realized the challenges of going through and moving it forward, they realized this is not possible, and the state has to pick it up. So today, the revenue share to maintain this particular program, 60% is from the center, 40% is from the state. And if 40% is from the state, it's no wonder that today, as of yesterday, 29 states have only signed up. Why have the others not signed up? Because they already have some very well running programs. And they feel they are running perfectly and they don't need to change it. Will that stand the test of time going forward? Nobody knows. Having said that, what does this beg? This begs a new business model. This begs a new business model, and that's the question, and that's what I appeal to all of you in the room. What is that new business model going to be like? It cannot be business as usual. Because clearly from what I showed you in the earlier slide, the situation for the existent business model, no longer is it healthy enough to continue. Most important is going to be a change in business model to cater to affordable segments. This is the crux and the key. This is a very interesting slide. If you look at this slide, just look, it's giving us pointers as to what that new business model will be like. If you see diagnostic chains, Dr. Lal Path Labs, ThyroCare, despite the bloodshed everywhere, they continue to grow. So the question here for all of you is this catering to the 90% of care or to the 10% of an individual's care? Where is this targeting? Where is this moving? Clearly, it demonstrates that the normal sense of business of tier 1 overserved areas is history. Are we unique? And this is my last slide, where I leave you all to debate and discuss during the day, that we in India are certainly not unique in our problem. Even a mature healthcare, insurance-based country like the United States, which spends the maximum of its GDP on healthcare, suffers from, the print would be small, but the last paragraph in this is showing two things. Number one, the interest of people to go into the medical profession is dwindling. The demand is going up. By 2030, the United States will be short of 121,000 doctors. Forget us with our ratios. I purposefully did not put the ratios up of where we are. We all know them. That's problem number one. Problem number two is, how far removed has family practice gone away and leaned towards the dependency on what technically should be the underpinning of services. However, each one of us, even the patient, thinks of it and looks at it like a great pot of gold at the end of the rainbow, and that's technology. You cannot get away from the human interface. So what kind of human interface is this going to be? What is this new individual going to be like? How is it that we are going to be able to harness the existent workforce into the system to be able to channel and give us the new delivery model? Thank you very much for being a very patient and attentive audience, and I really look forward to all your commentary and suggestion. Thank you so much.